Hello, everybody, and thank you for joining another episode of Wednesday Wellness with Leora. Today, we are going to talk about a very, very important topic, which is the transformative journey from breast augmentation into explanting these breast implants. And we're going to ask the very important question: is it time for you to take action and remove your breast implants? What are the key indicators? What are the alarming signs that it's time for you to remove them? What are the risks associated with keeping your breast implants if they're starting to degenerate in your body even before they rupture? We're going to talk to our expert, Dr. Randall Feingold. He is the co-founder of New York Breast Reconstruction and Plastic Surgery. He's done thousands of these surgeries, and he has a really interesting clinical insight into all of the questions that we are raising. We're going to look into the trends of women removing their breast implant just simply because they have more awareness, and maybe signs that they thought were not related to having breast implants are actually related to toxins and silicone that is building into the body. Thank you, Dr. Randall Feingold, for joining us for this important topic on what are the key indicators for women to know that it's time for them to explant.
Thank you for having me, Leora. So the four key indicators that I see in women seeking explantation are pain with capsular contracture, which means a change in the shape of the breast or a hardness of the breast, rupture of an implant that might be detected on an ultrasound or an MRI, their awareness of having a textured implant that may put them at risk for developing a rare cancer of the breast implant capsule, or systemic symptoms that we call breast implant illness.
Before that, are there any specific screening that can measure the condition of the breast implants or your immune system respond to the breast implants?
Unfortunately, it's really not easy to figure this out just by looking at a breast or examining a breast. A breast can be soft and feel normal, but it may be hiding a ruptured implant underneath.
Yeah.
A breast may have a hard capsule, and we may think it could be caused by a ruptured implant, but yet it could be an inflamed capsule with an intact implant itself. So physical exam is limited. Blood tests do not specifically detect a leak or a rupture or a breakdown of an implant.
Yeah.
There are blood tests that indicate general inflammation or immune system activation or autoimmune conditions, but that's not specific to implant rupture.
Have you seen, like, among your patient, like specific markers that actually later on were related to breast implant illness?
Well, there are immune system activation findings like sedimentation rate, rheumatoid factor, ANA factors, CRP levels. They're not unique to BII, but they are elevated in many patients with systemic symptoms, and that alerts us that there is something that needs to be investigated.
This is really such a difficult condition to, I would say, to discover. But what are the most common symptoms that are related to breast implant illness that you have heard your patient again and again complaining about?
By far, the most common complaints are brain fog and fatigue. But many patients have skin rashes, hair loss, joint pain, GI absorption issues. So it's not uncommon to have many of these symptoms together in the same patient. I also hear about migraines, and there are other symptoms as well.
So what do you think prompts women to actually come to you? And because there is not such as certain accurate diagnosis to breast implant illness, but what, after all, bring them to the point where they're saying, okay, I had enough with this, although it looks good and I wanted this breast augmentation in the past, I feel that I have to remove them.
Well, I think what you're suggesting here is a frustration level that patients reach when they don't have answers.
Yeah.
They have symptoms, and we know that nobody knows your body better than you. If you have symptoms, they are real, but they're not getting answers from other physicians who may not give proper credit to their symptoms, or they've had medical testing, rheumatologic evaluation, endocrine evaluation, infectious disease evaluation, and it either doesn't point to a classic disease or they have soft findings that don't meet a typical, diagnosis. They've kind of ruled out by process of exclusion these other conditions. and the only thing left is the foreign object of the implant in their body that may be giving them symptoms on their chest wall, whether it's pain, change in shape or hardness of the breast, or just the suspicion that the only thing that's changed in their life since these implants were placed were these symptoms,
Yeah.
and that there may be a cause and effect. And it's not an unreasonable thing to investigate.
So that really brings us to, you've been advocating for on-bloc explant for surgery for many, many years. Can you explain to our viewers and listeners how that differ from a normal removal method, other normal removal methods?
Any plastic surgeon can remove a breast implant in less than 10 minutes. Small incision, pull out an implant, whether it's saline or silicone. If it's ruptured, there would be a lot of residue that would take quite a bit longer to clean out, but you'd never get it out completely. When we remove the capsule around the implant, we're removing the implant on block or contained within that intact capsule. And that ensures removal of that inflamed scar wall that the body has established between itself and the implant. Why is that important? Well, there's inflammation in the capsule. In a surprising number of patients, there are bacterial colonies harbored within those capsules that may be secreting inflammatory enzymes. On rare occasion, I have found fungus in those capsules. And unfortunately, there have been several patients that have had lymphomas, squamous cell carcinoma, B-cell or T-cell abnormalities within their capsules that are discovered only when we send the capsules to the pathology laboratory. So I think it's important to remove the capsule. And the last thing we want is to have controversy after an implant removal where there's a surprise finding within the capsule, but the surgeon declares to the patient, I only removed a portion of the capsule. And so that diseased or affected capsule still remains in the patient, which complicates their recovery or suggests the need for yet another operation.
How does a patient know that the plastic surgeon has removed on-bloc explant their breast implants? What proof can they ask for?
Well, I think first, there are plastic surgeons that have developed experience, real expertise doing complete total capsule removals. And there should be a conversation ahead of time about whether the surgeon is comfortable taking care of a patient who has symptoms, intentionally wants that whole capsule removed. If a plastic surgeon is not comfortable with the procedure, they really should be honest and say, this is not something that I do in my practice. I do give patients photographs of the capsules that I take out. I find that it gives them peace of mind so that they know it has been accomplished. And then I send that capsule to the laboratory for pathology and samples for bacterial and fungal cultures. And then I provide them with copies of their pathology reports and their bacterial and fungal culture reports so that they understand that they've had the proper, evaluation, and hopefully it answers certain questions for them.
Let's go over the typical recovery after on-bloc explant surgery in terms of downtime and discomfort.
Well, it does start with the operation itself. It probably takes an hour on each side for me to do a total capsule removal. And that 2-hour procedure could be a 3-hour procedure or more if there are other aesthetic refinements being done to the breast during the closure process. If the capsules are removed from under the pectoralis muscle, then a portion of that capsule is being removed from the surface of the rib cage. It does take a little longer. It does cause some more pain. And in those patients, I will inject a long-acting anesthetic as a nerve block in their rib cage to help with postoperative recovery. And then I leave a drain tube behind in all the patients that I do capsulectomies. So the recovery period after that is probably 4, 5, 6 days with a drain tube, no exercise at home, not driving a car as of yet. That first postoperative visit, the drain tube will be removed, a different bra will be provided. Patients are generally able to drive a car and be more fully active after that. But I would warn patients not to work out at a gym for 2 weeks, and that includes treadmill, spin class, weightlifting, general exercises that could raise your blood pressure and make something bleed. That doesn't mean that you're ready to do chest wall exercises at 2 weeks, because the pec deck or the bench press or a push-up is going to put all the energy on your pectoralis muscle, and that may take 4 weeks or 6 weeks to be comfortable doing those types of exercises.
Now that you mentioned muscles, in terms of muscle attachment, does any every patient need a muscle attachment repair during on-bloc explant surgery?
Well, the patients who've had their pectoralis muscle divided and lifted off the rib cage to insert an implant under the muscle should have that muscle reattached back to the rib cage. That's the way God designed us. That's the way that we get the most effective use of the muscle for strength and for range of motion of our arms. And if you don't reattach that muscle that's already been lifted off the rib cage after you remove that implant and its capsule, then that muscle is going to retract upward like a window shade. It may be visible as a lump in the upper part of the chest in a very slender patient, but it's certainly not going to have the most effective power and range of motion unless you restore it to its normal geometry. For women who've had implants placed under the breast tissue but above the muscle, then there's no reason to repair or reattach the muscle because it was never disturbed during the original implant placement.
Well, I have a really interesting question. And it comes from really having friends, my generation, 60 years old plus, 50, 60s, and that had the breast implant for over 20 years. Some of my friends surprisingly had it for 30 years, and their ultrasound or mammography results were normal. Do you still recommend them that they should, despite the normal typical screening result, remove the breast implants?
Well, first I'm going to say that your generation is my generation. I'm in that age category. But a lot of women believe, that urban mythology that breast implants should be changed every 10 years. And the truth is, you're not an automobile. You don't need an oil change every 10 years or 10,000 miles. It really goes to whether the implant is intact and whether or not you have symptoms, whether it's related to contracture, rupture, or other systemic symptoms. I've been fooled where ultrasounds and MRIs reported normal implants. But the patient presented for implant removal for any number of reasons, and there was the surprise finding in the operating room that the implants had already degenerated or ruptured. I didn't find that out until the capsule and the implant was removed intact, and I opened it on the back table. And then when I opened the capsule, I discovered the implant was ruptured. But at that moment, that validated my approach to always removing the capsule with the implant within it because it prevented any spillage of the leaked silicone into the patient's, body cavity during the surgery. And there was one case I remember where a patient had an MRI and was told to have the implant removed because it was ruptured. And surprisingly, there was an intact implant in that capsule. I think it may have folded on itself and given like a false positive finding to that radiologist. But high resolution ultrasound and MRIs are important screening tests to check for intact implants. The FDA recommends doing one or two of those studies after 5 to 6 years and every 2 to 3 years thereafter for life. If a woman is over 35 or 40 years old and is getting breast cancer screening, mammograms are not going to provide the same quality information, whether an implant is intact compared to high-resolution ultrasound or MRIs.
So there are two things that I wanted to mention that in 2022, there were research studies coming from Netherlands, from Europe, showing that breast implants are actually bleeding into the body slowly before they get degenerated. And my question is, if a woman has implants for 10 years and 15 years, and I think that most likely she has already symptoms, but maybe she's not associating the symptoms with having breast implants. So is it worth actually looking into the symptoms and saying, okay, your imaging results are fine, but considering the fact that you have all these autoimmune symptoms, that may indicate, that you have to remove them?
Well, without a doubt, you are correct that it warrants investigation. And I have several patients with intact implants by imaging and by physical examination in the operating room. And yet the pathology report on the capsule shows silicone droplets embedded in the capsule, even though the implant was not ruptured. And that's probably a process called gel bleed, where silicone gel seems to be able to diffuse through an apparently intact implant envelope. And I have patients that have intact implants that I've removed, and yet they've got the finding of silicone in regional lymph nodes, whether it's in their armpit or in their chest or in their neck.
Wow.
So an intact implant by ultrasound or MRI is quite reassuring in terms of the likelihood that it has integrity, but they are not 100% sensitive. And there are patients that have a silicone gel diffusion into the body despite what appears to be an intact implant. So these are, long-term devices. They're not lifetime devices. They definitely have imperfections. And I guess the real question for plastic surgeons today is, to what degree did they discuss this when patients are contemplating putting breast implants in?
How do you monitor your breast health after the surgery?
So just like my breast reconstruction patients who I reconstructed after mastectomies, my explant patients I maintained for long-term follow-up. And that may be in the first few weeks and the first few months, and depending upon their symptoms, a year or 2-year follow-up. But I try to maintain annual visits with my patients to see if there's a recurrence of symptoms or progression of symptoms or any later changes in their breasts. So I think each plastic surgeon has their own, comfort level about when to continue monitoring to their patients or when they discharge them from their practice.
Is there any ongoing support right now that you are giving to your patients, whether it's resources or, community? Have you created a community that can support the patient pre-operation and post-operation?
Well, yes, I do have a breast implant support Facebook group, and that is a private group so women can share their experiences. I don't monitor or interfere with their conversations. They can honestly help each other with the information related to the commonality of their symptoms and their anxiety about having surgery and how they felt after surgery in the short term or the long term, or even their cosmetic outcomes. And in addition, there are newsletters that are distributed to patients who want to sign up for wellness tips related to preparation for surgery, aftercare, after surgery, even intravenous nutrition and hydration and preparation for surgery or healing after surgery. Health is as optimal as you can make it prior to undergoing a stressful episode like surgery with proper vitamins and minerals.
Yeah, I think that umbrella that you're providing is really embracing, women that are quite often feeling, I would say, that sometimes lost, and they need that kind of support.
Don't forget, when people started reporting symptoms and there wasn't a lot of credibility assigned to those symptoms, the intravenous nutrition, at first I was skeptical myself, but so many of our patients, even my staff in my office who've undergone these treatments, have reported really good well-being feelings within a day or two of these treatments. And it's definitely given women more confidence when they're going into surgery feeling chronically fatigued.
As a matter of fact, this podcast that we have been recording, the whole goal and purpose is really to raise awareness among women and help them make better decisions during the journey to wellness.
Well, I hope this was helpful, and I look forward to the next episode. Thank you.
Yes. So to our viewers and listeners, thank you very much for tuning in, and stay tuned for our next episode, which is all about 2024 update on restoring the breast after en bloc explant. Stay tuned. Thank you very much, Dr. Feingold. See you soon.
Thank you.